When packing for the hospital, consider bringing the following: loose-fitting shorts or sweats for physical therapy exercises. We consider our total joint patients to be healthy. We will assist you to get dressed and be out of bed the morning after surgery, so having casual clothes will help make you feel comfortable and relaxed. Undergarments and comfortable shirts that are easy to get on. Glasses if you wear them. Toiletries for 1 or 2 overnights. Shoes that will support you when you get up to walk. You may also consider bringing things to help pass the time, such as books, magazines, or laptops. The hospital has Wi-Fi. If you have sleep apnea, you have been prescribed a CPAP or BiPAP machine. Please bring this machine with you to use after surgery. Bring a list of your current medications with dosages and the last time you took each of your medications. Often patients will ask us if they should bring their own medication. It is not necessary unless you take a medication that is unique to you. If you do bring it, make sure it is in the prescription packaging the pharmacist provided you. The surgeon's office will tell you what time to report to the same-day center. If you need to know earlier than the day before in order to arrange for a ride to the hospital, call the surgeon's office for this information. In general, surgery takes about 2 hours, but in some situations it can take longer. After surgery, you will be supervised in the recovery room until it is determined you are awake and able to be in a regular patient room. Usually this takes about an hour, but it can take longer at times. As a family member or friend, if you are ever concerned about the status of things, please ask a hospital employee for help in getting your questions answered. We want to hear from you. Family or friends who support you will be directed to wait in the surgical waiting room. This is where the surgeon will come to find them to discuss how surgery went. After recovery, you will be transferred to 5 North, where you will be reunited. This is where all patients who are staying overnight after surgery go. You will be cared for by nursing staff that are specially trained to care for total joint patients. As we prepare you for surgery, you will have an IV for fluids. This allows us to administer anesthesia, pain medication, fluids, and IV antibiotics to prevent infection. We are required to question patients about the specifics of the procedure they are planning to have as we process them for surgery. Don't be alarmed if you are asked more than once what you are planning to have done in the operating room. A catheter may be placed if the surgeon feels it's necessary. This is the type of catheter that would be used if a patient could not urinate or pee after surgery. We do not routinely use catheters and try to remove them as soon as possible if a patient needs to have one temporarily. We also don't use catheters because a person has to go too much or because their pain is too great to get out of bed to go to the bathroom. The first choice is always to get a patient up and out of bed, starting on the day of surgery, to use the bathroom. Patients prefer this because it makes them feel more normal. Just like there is bacteria on your skin, we also carry bacteria in our nasal passages. To prevent this from being an issue, we use a betadine nasal swab as we prepare you for surgery in the same-day center. These swabs are the most effective way to kill all nasal bacteria that can cause surgical site infections. We have established a very effective combination of medications to keep you comfortable during your hospital stay. We use anti-nausea medications routinely before a patient even experiences nausea. This is done because if a patient were to become nauseated, it can be very challenging to alleviate it. Believe it or not, nausea, rather than pain, can delay your ability to get out of bed. Fortunately, nausea doesn't last long. If you have a history of nausea after surgery, please let the anesthesiologist know. Anticoagulant is a fancy name for blood thinner. Because patients are at risk for blood clot development in their lower leg after joint replacement, all patients need to be on an anticoagulant. An adult dose aspirin is used for 4 weeks after surgery in most cases. If a patient is either on a blood thinner already or at a greater risk to develop a blood clot, they will be put on a stronger anticoagulant after surgery. This will be determined by the surgeon and the physician who manages the patient for this condition. We are required to give all total joint patients a dose of IV antibiotics before surgery. We continue the antibiotics for 24 hours after surgery to help prevent infection. It is normal and expected to have pain after joint replacement surgery. There are many types of medications that can be used in combination to control pain. We use a combination of oral medications. These include narcotic and non-narcotic options. Ice, which is a very effective pain management tool because it will block pain receptors to help alleviate pain, and it will limit swelling that can occur. If you don't currently own a gel-type ice pack, you should purchase one for use when you return home. Movement is essential to control pain. Most patients, if asked, would admit that pain control is something that is on their minds before surgery. And pain management is important to us as well. Because there is no way for us to measure your pain, we developed a pain scale. The pain scale is designed to help you communicate how much pain you are in. When a nurse asks you to rate your pain, they're looking for a number that reflects the amount of pain you feel. So if 0 is no pain, then 1, 2, or 3 is mild pain. 4, 5, or 6 is moderate pain, and 7, 8, 9, or 10 is severe pain. So if you were asked about your pain and you told the nurse your pain is an 8, then we would give you pain medication. After an hour passes, if we ask again about your pain and it is still an 8, then we know we need to do something else to try to control your pain. The most important thing to remember about pain is that we consider you our partners in managing your pain. If you are in pain, ask about what the options are to control it. Do not wait until we bring up the subject of pain. Along with ankle pumps, blood-thinning medication, and walking, you will be wearing intermittent compression devices to help control and prevent blood clots. These devices are sleeves you wear around your calves when you are in a chair or in bed. There are 3 chambers of air that will inflate intermittently and encourage blood return up your leg. We use a waterproof dressing to protect your incision. It is placed in the operating room and left there until your staples are removed. This dressing will allow you to have water from a shower run over the area you had surgery without concern for it getting your incision wet. We want to protect your incision from anything that can cause an infection. You will be able to be up to the bathroom or to sit in a chair with a walker and nursing assistants on the day of surgery. You will be able to bear weight as tolerated on the leg you had surgery on the day of surgery. You will have physical therapy for progressive walking and exercise. Physical therapy will start either the day of or the morning after surgery. Our days start early as we want to make sure you have a chance to eat, bathe, use the bathroom, and get dressed and medicated with pain medication before therapy.
After surgery, for the total hip replacement patients, there are 3 hip precautions. Rule of thumb is to maintain these precautions for approximately 3 months. The first precaution is no crossing the legs, not even at the ankles. So this is not allowed, and this is not allowed. So the second rule is the 90-degree rule. The basic take-home message for the 90-degree rule is we don't want your thigh any closer to your chest than mine is right now. That means no bending forward and no bringing your leg up. That leaves you wondering how you'll get your shoes on and how you'll get dressed without breaking the precautions. Our occupational therapist will meet with all the total hip patients to review adaptive equipment that will assist you in all your ADLs without breaking your hip precautions. We often suggest patients place a pillow between their legs to maintain their total hip replacement precautions while they're in bed. For the total knee patients, it's more positioning than precautions. We often suggest rolling up a towel underneath the ankle to encourage straightening of the knee when you're in your chair or lying in bed. A position to avoid after total knee replacement is putting a pillow underneath your knee. Although a position of comfort, it feeds into the bending of the knee, which we want to avoid.